Good afternoon, and thank you for joining us. On today's briefing, we'll hear from Milwaukee County Executive David Crowley, Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services with the Milwaukee County Office of Emergency Management, and Kirsten Johnson, Commissioner of Health with the Milwaukee Health Department. County Executive Crowley, I'll hand it over to you to get us started.
Well, thank you so much, Catherine, and good afternoon to everyone joining us. I want to start off by talking about yesterday. I had the opportunity to join Senator Tammy Baldwin, Congresswoman Gwen Moore, Mayor Baird, as well as Commissioner Johnson for a tour of the new vaccine clinic at the Northwest Side Center. And I was able to walk around the facility and speak with several frontline workers who are actually helping to educate the community members about the vaccine and administer the shot if individuals were really ready to receive it. And it was encouraging to see people coming to the health center to ask questions, get the shot, and making sure that they're making an informed decision about the vaccine. The staff was willing to answer any and all the questions that folks had, and it was important to them that individuals had the time and space to get their questions answered. And this site and this visit yesterday is a great example of the collaborative partnership between the state of Wisconsin, the city of Milwaukee, and federal partners, all advocating for progress on vaccine equity. And getting the vaccine is still our best option in fighting COVID-19, especially as we are experiencing a rise in cases throughout this country. And just last week, President Biden set a goal for 70% of adults in the United States to get their first dose of vaccine by the 4th of July. And so we want to encourage everyone in Milwaukee County to help us meet this national goal. And if you're on the fence about getting a vaccine shot, go to healthymke.com to learn more. You can hear testimonies from community members and locate a vaccination site near you. And I know many folks are tired of hearing this, but until a greater percentage of the population is fully vaccinated, wearing a mask in public, avoiding crowded areas, and sanitizing when possible is still some of the crucial tools that we have to slowing the spread of COVID-19. And so I really want to encourage everyone to consider how these practices, again, affect your community, your family, and yourself, because we all have a role to play in protecting one another. And as we talk about caring for ourselves and others, I want to also acknowledge that this month is Mental Health Awareness Month. And over the past year, we've seen a dramatic increase in substance misuse throughout Milwaukee County and throughout our nation. Addiction thrives in isolation. So the pandemic has not only made it easy for those struggling, but has not made it easy for those struggling and the loved ones that are supporting them. And so the first step to reclaiming yourself, honestly, is to really seek some help. And so if you or a loved one is experiencing substance addiction, please do not hesitate to reach out to one of the many support systems available right here in Milwaukee County. The Milwaukee County Behavioral Health Division has an easy first step to get you started. So you can call the crisis line, and that number is 414-257-7222. Again, that number is 414-257-7222. And when you call, the call is free. And I want to pivot to talk about the U.S. Treasury Department. They recently released their guidelines for state and local governments, specifying how they may use funds provided through the American Rescue Plan Act, also known as ARPA. And this means that we now have more clarity as to how the county will be able to use these support funds. And these funds will can go towards, supporting public health expenditures, addressing negative economic impacts caused by the public health emergency, replacing lost public sector revenue, and providing premium pay for essential workers, and investing in water, sewer, and broadband infrastructure. And so we're excited to see these funds coming down the pike that will significantly assist us in providing the critical resources that many of our residents need. And so we are putting together a framework to allocate these resources where they are needed most throughout all of our community. And we will share more of that information in the coming weeks and months as we get those prepared. And so with that, I'd like to hand it over to Mayor Baird. Mayor Baird.
Well, thank you very much, Mr. County Executive. And I want to say hello to everyone this afternoon. I'm pleased to say that today is a day with some good news. I'm always excited when we have good news to report. And I think we all understand what the best new news is, and that's the fact that people as young as 12 years old can now receive the vaccination with the new authorization from the FDA. It's the Pfizer vaccination. I had conversations yesterday with the school superintendent, and the Milwaukee Health Department has been talking to the schools as well. I think that there's a desire from all parties to be able to have these in schools for the kids between 12 and 16. We're going to obviously have to work out some of the issues relating to permission from parents or guardians to make sure that the kids can have it. But it certainly is a step in the right direction. And I want to continue to see our numbers grow. We know that as of late last week, we had in Milwaukee County a little over 35% of our residents being fully vaccinated and a little over 42% of our residents having at least one shot. But we also know that there are some real disparities. And if you look at the different zip codes or the different census tracts, there are going to be some zip codes and census tracts that have a much lower penetration. Many of those are in the city. And that's why we are making such a concerted effort to bring the vaccinations to the people. We feel that what has been done at the Wisconsin Center has been phenomenal. And that has really served those individuals who are eager to get the shot. And we're proud of the partnership that we have had with the federal government. We're proud of the partnership we've had with FEMA and the state to accomplish that. But we also know that we have to pivot. And one of the things I'm proudest about our health department over the last 14 months is just how quickly the personnel of the health department have been able to be nimble, to get additional help from other city employees, first on the testing and now on the vaccinations. And we're going to continue to try have more outreach. And I'll talk about some of the outreach efforts in a few minutes. We're also evolving, if you will, in other areas as well. As many of you know, working very, very closely with the health department, the Milwaukee Bucks and the Milwaukee Brewers over the last few weeks and few months have been able to have fans attend those sporting events. We know that there is hunger and thirst for more people to get permission to attend those games. But now both the Brewers and the Bucks will be allowed to have more fans in the stands with 50% capacity. And Commissioner Johnson can provide more details coming up on that. Also in the good news category is the trend in new cases continues to head lower in Milwaukee County. We would like to see it head lower even more so in the city of Milwaukee, obviously for the reasons that we've got a lot of young people that now have been contracting the disease. But we want it to happen throughout the entire community. We want to see these rates come down. The county executive mentioned the American Rescue Plan, and we are very, very pleased to have received the guidance, and we'll be receiving the first allocation. It was a little lower than we had expected. We had expected $406 million. We will get $394 million. So as much as I'd like that additional $12 million, I am certainly not complaining because I think President Biden and those members of Congress who supported them really recognize the challenges that local governments and state governments face. And I am immensely thankful to them for their assistance. This is a time when our federal government has responded. It has responded in a way that unfortunately our legislature has not responded. But tomorrow, May 12th at 6 p.m., I will be hosting a virtual American Rescue Plan information session. You can join me via GoToMeeting to learn about my priorities for funding and discuss with me how these dollars can positively impact Milwaukee's future. You can register online in advance. The link to do so is available on my social media channels, Mayor of MKE on Twitter and Mayor Barrett on Facebook, if you would like to attend. And this is part of my effort and the council's effort and the city's effort to be transparent and inclusive. We want people to know what we're thinking. We want to hear what people have to say. But this is going to be a pretty significant undertaking. And what I've been trying to do is really coordinate as much as possible with the county, with the state, and with the school district to see if we can stretch those dollars. So I'm interested in housing. I'm interested in early education. I'm interested in avoiding evictions. I'm interested in infrastructure, lead issues. I'm interested in broadband. There's a lot of areas where I think we can have a real positive impact on dealing with how we come out of this pandemic. In terms of vaccinations, the city continues to offer quick, easy, and free vaccinations for Milwaukee residents at the Wisconsin Center and Northwest and South Side Health Centers. In addition to these sites, we are continuing our work in the community to bring vaccine to the people. And I'm very, very proud of that. Again, our health department has been incredibly creative and nimble in trying to get as many people served as possible. So tomorrow, May 12th, Ascension All Saints Family Health Center, located at 2400 West Villard, will be offering vaccinations to the public from 1 to 5 p.m. Thursday, May 13th, Employ Milwaukee, which is located at 2342 North 27th Street, basically 27th and North, will be offering vaccinations from 1 to 4 p.m. Friday, once again, the Mexican Consulate, which has been a great partner, which is located at 1443 North Prospect, will be continuing its weekly vaccinations from 3 to 5. Saturday, May 15th, the Wisconsin Black Historical Society, located at 2626 West Center Street, will offer its monthly vaccinations from noon to 4 p.m. And as the commissioner will touch on later, Black Husky Brewing is doing something very creative. It will be offering vaccinations on Saturday afternoon with the incentive of a free beer for vaccinated individuals. So this is certainly a situation where different strokes for different folks, but we want people to be vaccinated. And with that, I'll turn it over to Dr. Weston. Dr. Weston.
All right, thank you, Mr. Mayor. Good afternoon. First to our numbers, we're currently seeing an average of 102 new cases a day and about 1 death every 2 days. We continue to see encouraging gradual downtrends across the board, from cases to percent positivity and hospitalizations, as well as deaths. And this is undoubtedly the result of the uptake to this point of the vaccine in those 16 and older in our community. And soon we can extend that age group. We heard exciting news from Pfizer and the FDA yesterday regarding the vaccination in the 12 to 15-year-old age group. So this was, of course, the FDA expanding the emergency use authorization of the Pfizer vaccine to include children aged 12 to 15. So the CDC's Advisory Committee on Immunization Practices, or ACIP, will meet tomorrow and are expected to recommend to the CDC director that authorization for this age group. So based on that timeline, we could see availability of the Pfizer vaccine for that age group as soon as later this week. So how did this happen, and how do we know that the vaccine is safe and effective in this population? So these trials in 12 to 15-year-olds underwent the same 3-phase study as any other medication or vaccine. They followed 2,260 individuals in that age group. They gave half of them the vaccine, and they gave the other half a placebo, which is a harmless injection without any medication present. So the patients and the researchers were blinded. That means they didn't initially know who got which, whether you got the vaccine or the placebo. And so now to the results. While in the placebo group, those who did not receive the vaccine, 18 of the children ended up getting symptomatic COVID infection during the study. Now, not a single person that was vaccinated got infected. So that means 100% efficacy from the vaccine. You couldn't ask for better results in protecting 12 to 15-year-olds from the COVID virus, both the short-term as well as the long-term effects of COVID infection. So the next question, of course, is about safety and side effects. So the side effects in kids were very similar to the side effects that we've seen in adults. Many had a bit of a sore arm, and less than that had the same sort of things we've been seeing with the vaccine, things like fatigue, headache, chills. Those that had those side effects, they lasted about 24 hours, just like with adults, and then they went away and they felt fine and gained the protection and the immunity from COVID. So in the end, the scientific facts are that this is a safe and effective vaccine for children aged 12 to 15. And this is welcome news for parents of children in this age group and for the children themselves looking to get back to life as normal. Summer camps, sleepovers, sporting events, all the activities that have been overcast by a level of risk and concern. And our children's lives in general have been overshadowed this last year by that same level of risk and concern. So just as you vaccinated your child for measles, for mumps, hepatitis, for meningitis, to protect them from those diseases, so too should you protect them from COVID with this vaccine, studied in the same way as all those other vaccines that we give our children. Our health departments, our health systems, and schools will be working to provide easy and convenient methods for vaccination of this age group in the coming weeks, if not sooner. So please take advantage of these services. The vaccine is safe, it's effective, and remember, it's free as well. Thank you and stay safe, and I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. As Mayor Barrett and Dr. Weston mentioned, we're excited about the FDA EUA of Pfizer vaccine for children over the age of 12. Once we receive final approval from the CDC and Wisconsin DHS, the health department will vaccinate 12 to 15-year-olds at the Wisconsin Center, both the Northwest and Southside Health Centers, and at our mobile vaccination clinics. I plan to bring my own 15-year-old son in as soon as we have the green light, hopefully Thursday. We're also working with MPS and non-MPS schools to bring the vaccine directly to students. The health department has worked closely with the Bucks and Brewers throughout their seasons. They have been vigilant in upholding and enforcing safety practices. As Mayor Barrett stated, beginning this Saturday, May 15th, their capacity will be increased to 50%. In addition, beginning on May 15th, self-service can be reinstated at all establishments. This includes salad bars, beverage stations, and buffets. We've made this decision after looking at the past year of trends in COVID cases. Last year, beginning around this time in the spring, we saw a decline in positive cases, which we attributed to an increase in outdoor activities. This year, with the addition of vaccinations, we've already seen a similar decline with a decrease in disease burden this week. Finally, the mayor mentioned some of the upcoming mobile vaccination clinics, but I wanted to highlight two initiatives that we're particularly excited to announce. Beginning on Thursday, the health department will offer vaccines at 3 Milwaukee public libraries. Every Monday, Wednesday, and Friday during library standard operating hours, Zablocki and Washington Park libraries will be staffed with vaccinators. And on Tuesday and Thursday, Mitchell Library. This consistent presence at our community libraries is part of our initiative to bring vaccines to where people are. And we hope this will be a great opportunity for parents to get their children vaccinated as well. I also want to extend a thank you to Black Husky Brewing, who have been terrific partners and advocates for vaccine. They're stepping up again this weekend to host their Double Your Dose vaccination clinic. On both Saturday and Sunday from 12 to 6 p.m., we will be on site to administer vaccinations. If you bring your unvaccinated friend to the brewery to get their shot, you'll get a free beer too, in true Milwaukee form. If your business or company would like to offer vaccines, please call 414-286-6800. Thank you.
Thank you. And we'll just wait a minute as we ask for the reporters to put their questions in the chat. All right. Our first question comes from Allison Durr with the Milwaukee Journal Sentinel. She says, how does expanding the vaccine to ages 12 to 15 affect the weekly doses the city will be requesting?
So we have pretty significant vaccine inventory right now. So we will continue to ask for vaccine as we need it, but we ask weekly for the number of vaccines we need.
Another question for Commissioner Johnson from Hillary Mintz with WISN 12. She says, for kids who receive their first dose at the Wisconsin Center close to closing date, will they be sent to another health center for dose number 2?
Yes, so we'll be registering them on site after their first dose for their second dose, either at Northwest or Southside Health Centers.
Excellent. A follow-up question from Spectrum News, Wisconsin. Are there any plans to administer vaccines in schools?
So yes, we are working with MPS and other schools within the city of Milwaukee to set up vaccine clinics for students.
Excellent. For Mayor Barrett, from Derek Rose with WISN 12, he says, as the NBA playoffs approach on May 21st, how exciting is it to have capacity for the games increase?
Well, one of the things we kicked around was whether we would allow the increased capacity only if the teams promised to win. But we figured we couldn't hold them to that. But other than the Bucks who lost last night, they've been playing extremely well. So I am optimistic as we go into the playoffs, but we know that that's a different season. But I think the players certainly feed off the energy. And as the commissioner said, both the Bucks and the Brewers really have been good partners with us in setting the health protocols. And so it's with that and with the trends that we are seeing that led the health department to reach the decision that they can increase the capacity. The fact that they've been such good partners. And again, we're seeing progress, and that's what everybody wants to see. So for any good fan, particularly as we get to the NBA playoffs, it's going to be great to see more people in the Fiserv Forum.
Sharon Bajenda with CBS 58 is wondering how soon will vaccines be available at schools?
We're hopeful we'll have vaccine available at schools as soon as next week.
And Madeline Anderson with Fox 6 is wondering, do you know how many children ages 12 to 15 are in Milwaukee County? And can you go into more detail about how and when the shots will be available to students within MPS?
I'm sorry, I don't know the number of children off the top of my head. I know we were working on it earlier, but we do have a rough estimate of how many students that may be and how much vaccine to bring. Again, we're working really closely with MPS and other schools to make sure we can get shots in arms.
Thank you, Commissioner. Mike Spalding with WTMJ 620 AM radio is wondering what went into the decision to allow the Brewers and Bucks to increase capacity limits?
I think as Mayor Barrett said, we've worked really closely with them throughout their entire season and are very confident that they've been holding true to the safety standards we've put out there, to their safety plans. They're really working hard to assure people are wearing masks, how they're serving food, how people are seated. We're very comfortable increasing their capacity, also knowing that our numbers are starting to decrease. Specifically the Brewers, it's mostly outside. Hopefully they can keep the roof open as much as possible, but also in Fiserv Farm, it's a big space and they've done an excellent job working with us to make sure their fans are safe.
Thank you, Commissioner. Hillary Mintz with WISN 12 says, the mayor mentioned a plan to vaccinate kids in school. Can you talk more about that plan?
I can speak in really generalized terms about the plan, but we're planning to have vaccine clinics set up in schools. Obviously, we need parental consent for vaccination. We're working with MPS and other schools to send those consent forms to families so they can be signed. One unique aspect is the consent form. It's once a parent consents for one dose, they would be consenting for both. But trying again to make sure there's the minimum number of barriers and that kids have access to a vaccine.
The next question is for Commissioner Johnson from Allison Durr. She says, are you able to say how much vaccine inventory the city currently has, particularly for Pfizer?
I don't know the number off the top of my head, but we have a fair amount. And most of it's in a deep freezer. Again, we access it as we need it during the course of the week. And the state has ample supply of Pfizer for us as we move forward.
Derek Rose with WISN 12 has a follow-up question regarding increased capacity. Does that capacity increase also affect the Deer District?
So no, it really is specific to large venues that, so for example, the Bucks and the Brewers. Most of the places in the Deer District have standing safety plans that allow them more than 50% capacity already.
Sari Lesk with the Milwaukee Business Journal has questions for Commissioner Johnson. She's wondering, is the change that takes effect Saturday limited to more capacity for the Bucks and Brewers along with the addition of self-service, or are you changing capacity limits for other types of gatherings too?
As I just said, it's really about the large gathering limits. So the Bucks and the Brewers in particular had obviously they're big spaces. So they were limited based on their safety plans to 25 or 32%. But the vast majority, if you look at our order, the vast majority of businesses either have a safety plan in place that allows them for significantly more than 50% or 75% based on the current order.
Hillary Mintz with WISN 12 says, from an accessibility standpoint, is vaccinating kids in school the best plan logically to vaccinate the most kids?
So this is really going to be done in partnership with many healthcare partners. There's a lot of primary care providers and pediatricians in the city. I know Children's is also working in this space. I think from our perspective, we just want to make sure that kids have access and knowing that a large number of 12 to 15-year-olds are actually in school in person in the city. So we want to, again, bring the vaccine to them, eliminate as many barriers as we can.
Okay, I'm seeing two clarifying questions, one from Derek Rose and one from Emily Files. Derek's question is, the Brewers expansion starts Saturday. When does the expansion start for the Bucks?
Saturday as well.
Thank you. And Emily Files with WUWM asks, would kids getting vaccinated at the Wisconsin Center, would kids getting vaccinated at Wisconsin Center or one of the health centers need their parent or guardian with them?
They do for their first dose. They need their parents there or a guardian there first to sign off on getting their first dose.
Right. And Sari Lesk with the Milwaukee Business Journal says she's looking for a little bit more clarification regarding the gathering limits. The comments all have related to the Bucks and Brewers, but are there others who would be affected? Essentially, are you changing the phase 6 order or just adjusting the terms of the safety plan for the Bucks and Brewers?
We are not changing the phase 6 order. It's really about adjusting the terms of the safety plans, existing safety plans.
Okay. Another question from Derek Rose. For a game at Pfizer, will there be any restrictions or other types of enforcement if a large crowd gathers at the Deer District between Punch Bowl Social and the entrance to the arena, as we have seen in previous years?
So I think it's the same sort of the same mitigation that we've been encouraging all along. So the masking outside and the distancing as much as possible in that space. And I would imagine the Pfizer Forum would be responsible for that.
All right. One more question from Allison Durr. Are you able to reiterate how much capacity will increase for the Bucks and Brewers this Saturday?
So they will be up to 50% capacity. And I'm sorry, I don't know off the top of the head. I think the Brewers were at 32%-ish or 25%, and the Bucks were at 18 to 20%. I'm sorry, I don't know the number off the top of my head.
I'm going to guess that it's going to be about 8,500 to 9,000 for the Bucks. These are guesses. And I'm going to guess it's going to be about 21 to 22,000 for the Brewers. Just knowing the capacity of those ballparks, that would be my educated guess.
Thank you, Mary Beth.
Sharon Bajenda with CBS 58 is wondering if either of the health officials on the call can comment or provide additional information for dosage information for 12 to 15-year-olds, and will vaccinators have smaller needle sizes to accommodate smaller arms?
So the dosing regimen is the same. Needle sizes does differ depending on body habitus. So not necessarily the thickness of the needle is still extremely thin, no matter who's getting the medication, but the depth of the needle, more about how far into the arm you push the needle than how long the needle actually is. So some providers may have shorter needles. They may just put the needle more shallow in the arm.
Thank you, Dr. Weston. Those are all of the questions I am seeing in the chat. Thank you all for being here today, and we will see you on Thursday.
Thanks, everyone.
Thank you.
Take care.